My name is Courtney Christensen. I'm a licensed clinical social worker. PCIT stands for Parent-Child Interaction Therapy. I always say play-based therapy when I describe PCIT because it's all done through play. Parent and child are in, I call it our playroom when there's toys in there, and intervention is delivered through play. So the child is playing, the parent is playing with the child, and they're using the various skills that we're coaching them on all throughout this whole play. Parents learn various PCIT skills that then they wear a headpiece in their ear, and I'm able to talk with them and coach them through using those different PCIT skills. The first phase of treatment is all about relationship enhancement. So we really work on beefing up the relationship that's in place. We really help parents and caregivers work on how do we address some behaviors just through using positive attention versus having to always go right to the negative or the discipline strategies. Once they've mastered the skills of that first phase of treatment, then we move into the second phase, which is where we do get a little bit more into the discipline strategies and what do we do when our kid doesn't listen to us. And once they've mastered those skills and they feel like they're at a place where, behaviors have decreased, they're able to manage what behaviors do pop up, they get to the point of graduation. Talking with families and thinking through the fact of okay, if we're dealing with this now and we don't do anything about it, what's going to happen in the future? If we don't do something and intervene at this level, at this age, before they get older and bigger and stronger, we really might have to have some of those conversations of what is that going to look like for them. A lot of times, by the time parents get to a point where they're okay, maybe we need to try this PCIT thing out that I keep hearing about, there's some strains in the relationship because there's been a lot of behaviors or just constant redirection, which is so draining on a parent where you just feel like you're constantly correcting them, telling them what not to do. And so a lot of times I feel like parents do come in feeling a little bit defeated, deflated. I do feel like a lot of families will be okay, well, we have more of the problem at school versus at home. How is this going to translate? Things like that. But the fact of the matter is everything starts at home, right? And so when we really can beef up things that happen at home, we can see some of that improve at school too. We also always encourage that communication between the school, the family, and ourselves. 3 things that I would say for people on the fence, should I do this? Should I not do this? Spend time with your kiddo. And I mean, that sounds super simple, but 5 minutes a day goes so far. And 5 minutes of uninterrupted, all distractions are off. Look for the positives in your kiddos. They're there on our tough days. Sometimes it's hard to find positives when it just feels draining and it feels like all you've done is redirect your kiddo all day, but there's something there. And look for it and praise it and tell them, great job washing your hands. Super simple things that we don't even think about, that just really helps those interactions and warms it up. The big piece with PCIT is that you do the homework, which is 5 minutes of special time with your kid. Sounds so simple, right? It's amazing what 5 minutes a day does for a parent-child relationship. Kids love it. I tell parents all the time, your kid will love coming here. And it's not to see me. It is because they get to have some very awesome quality one-on-one time with their parents. I've had a lot of positive feedback from parents when working with their kiddos and seeing the changes that their kiddos make. And at the end of the day, I always look back at the parent and I say, because you're doing the work. And that's what I love about PCIT, because it's so parent-based. Come on in. There's no harm in just coming and talking through it, right? And seeing, is this the right fit? Or is there something else out there that might be a better fit? I love PCIT and I love it because I've seen it work. I feel like I'm a little bit of the PCIT Kool-Aid fan because I've just seen it work.